I'm not sure if any of you joined our sessions, which we ran late last year after the sort of first lot of lockdowns, where we were talking about community centre guidance and safely reopening at that point. Not much has changed since then in relation to the rules. And so if anyone did attend that presentation previously, you will notice that there's just one or two small differences. Just a question though from me to start with. Has anybody already opened their centres? They have been able to since the 3rd of May. Are any of you already active?
We're planning to open on Sunday.
Fab. And which centre are you from?
New Inn Community Hall.
Brilliant. Okay. Well, hopefully this session will reassure you that you've got everything in place and are ready to go. But yeah, the guidance enabled us to open from the 3rd of May. And just a bit of background on me. I do work in an Iron Bevan's public health team. I come from a local authority background, not an environmental health or a public health one, but I've been working as part of the COVID response for most of last year. My focus more is on community wellbeing, and so I have a particular interest in reopening and restarting community activities, because we need to reconnect people to their communities, but we need to do that safely, and we need to do that at a pace that is right for the individual and for the groups running these centres. So we're going to talk about how to safely restart the activities. And it's going to be quite generic. If you have specific questions in relation to specific activities, then we can follow that up after the session. Feel free to ask them in the chat or by putting your hand up during the session, but there are likely to be things that I have to go away and check, because what I don't want to do is go with what I think. I need to be absolutely certain that the guidance I'm giving you is accurate, but please feel free to ask questions. We're going to talk a little bit about encouraging people back to community activities, and then TVA colleagues will talk a little bit about funding and support. So the guidance doesn't actually sort of define what a community centre is, but I think we're probably all on the same page, judging by the people that have attended the session this evening. It's a building owned or controlled by a public authority or a voluntary organisation which provides for the physical, social, cultural or intellectual development and welfare of the community. And we know that we've got lots of those centres doing fantastic work across Torfaen. And there's two sets of people here that have responsibilities in terms of getting these centres and these activities back up and running. The first is the management committee, as the people responsible for the building, and your responsibility is to take reasonable measures to minimise the risk of exposure to coronavirus by anybody accessing your venue. And the responsibility set out in the guidance is that you need to take all reasonable measures to ensure that a distance of 2 metres is maintained between people on the premises, to minimise risk of exposure to the virus. So thinking about hygiene and limiting close face-to-face interactions, or providing people with the space that they need to interact, and crucially to provide information on how to minimise risk. So we will talk about signage, directional arrows, etc. Later on. This presentation will be shared with you, so you will have these links to the guidance. The Welsh Government website is not the easiest to navigate, especially if you're not sure what you're looking for. These are the most up-to-date links that I found yesterday, but some of them might take you directly to sort of Google lists rather than the actual guidance themselves. And the second one on the list takes you to a track changes version by Welsh Government, but it is the latest information. You'll also see things about responsibilities as employers, and some of you will be employers. Community centres employ caretakers and managers, etc. And some of you may also have a bar, so the guidance for tourism and hospitality is relevant to you as well. And then WCVA have got some helpful guidance on their website where they've tried to summarise most of this stuff. It is current only to the 8th of November. However, as I previously said, much of the guidance at that time it hasn't changed much now. So you can use it, but just be mindful that there may be some minor amendments. And lastly, really, remember you can open, but you don't have to. If you don't feel ready, if members of your committee or some of your activities don't feel ready to open yet, then you don't have to. We want people to reconnect with their communities. We want activities to restart, but we don't want people to get anxious about it. And myself and my environmental health colleagues within the local authority are more than willing to help and support if you do feel anxious or concerned about anything. So these are the things that you need to think about, particularly the first one, if your building hasn't been open for some time. So are you up to date with the usual health and safety requirements? So the things that you would usually do regularly, such as fire risk, Legionnaires checks, is it? Things to do with the water and the heating, etc. Any regular maintenance checks, you really need to be sure that you're up to date with all of those things. And then the next thing is to determine the maximum number of people that can be safely accommodated within the space. So the current guidance is that there's a maximum of 15 people indoors, excluding people supporting activities. But that doesn't mean to say you can have 15 inside, because your room might only accommodate 10 safely with a 2 metre distancing applied. So you really need to think about the total space that you have and the total number of people that you can safely accommodate. If you can safely accommodate above 15, that doesn't matter, the limit is still 15. But if you can only accommodate 8, then the limit is 8, not 15. You also need to think about your pinch points and busy areas, so places where people might walk past each other, areas where people enter and exit the building, toilet areas, etc. And think about, ideally you would have one way in and one way out, but not everybody has got 2 doors, and you need to make sure that appropriate signage is in place to direct people around the space. As I've mentioned, the current rules are a maximum of 15 people indoors, but that excludes children under 11 and people working to provide voluntary services. But that has to be proportionate. So if you have 15 people at a session, a craft group or a coffee morning or an arts class or something, then it would not be reasonable to have 10 people supporting that session. So it has to be proportionate to the number of people involved. And then outdoors, the same rules apply. You need to think about the amount of space that you have, the amount that the amount of people that can safely be accommodated within that space, and then your maximum is 30 outdoors. Something I didn't mention this morning, that perhaps it might be helpful just to remind people of when we send out the presentation, Patrick, is the legislation is changing quite quickly. And restrictions are lifting over the next few weeks and months, and so these maximum numbers may change or will change, certainly in the longer term. So you just need to keep an eye out on the regulations to find out when you can increase your capacity. We've touched on this already, so it's about preparing the venue. Yeah, we've talked about all of those things, and you may need to have some conversations with your user groups about that, which we'll touch on in a moment as well. A little bit more on preparing the venue. So obviously we talk about inside the building and any outdoor spaces where activities may be run, but also you need to think about queue management outside the building. If people are waiting to come in, then are they standing 2 meters apart? Is there any way that you can put stickers or markers on the floor to help people manage that queue? It's just car parking and the amount of cars coming in and the way that they park. Does that help or hinder at all? But at the same time, be mindful that people do have an individual responsibility as well to maintain social distancing. Everybody is fully aware of the guidance and the requirements to do that. So you can only do your best, particularly when they're outside, particularly when they're waiting to come into an activity that's used by you. As long as you put reasonable measures in place, if people don't follow them, that's not your issue. Then once you've considered all of that stuff, you need to complete your risk assessment, and the Health and Safety Executive have got a template, a useful template, which is available at that link. And then once you've done your risk assessment, you need to make sure that any measures you've identified within that risk assessment are implemented. So part of that risk assessment will be cleaning and hand washing facilities, and there are a number of bits of guidance linked there that help you to understand the requirements within non-healthcare settings. And then you need to display your signage. So we can provide templates and in some cases actual posters for you to display. There's this floor stickers about keeping 2 meters apart. There's also the reminders to wear face coverings, and face coverings do have to be worn within community centres unless it is during an activity where there is not a requirement to do so. So things like exercise, things like people eating and drinking, they don't require a mask to be worn. But at any point during those activities, if people are moving around the building, then they need to put their mask on. If you've got activities where people are seated, whether they're taking part in an arts crafts group, a brownies group, or obviously that's dependent on the age of the children, but any kind of group where people are not exercising, eating or drinking, then they need to wear their masks. The exclusion is obviously children under the age of 11. And then the banner on the right hand side, the yellow shield, will talk a little bit about the Distance Aware campaign and what resources we have for that in a bit. I thought everybody sees at the moment the wash your hands, and I think actually, even though everybody understands washing their hands is really important, and I think most people are probably up their game on this, it is always a helpful reminder to people to wash their hands. And I particularly like the bottom left. If you look at washyourlyrics.com, and you can pretty much type in any song title and they will come up with the words to go alongside the images for hand washing, and people can have a bit of a sing along, which I think is a much more fun way of explaining to people how to wash their hands. And the images in this slide will be very familiar to you. We've all become very aware of social distancing in practice over the last nearly 14 months. And so you will need to think about your venue. If you have chairs and seating, if they're fixed seating, as in the images shown, then making sure that they're marked off in some way to ensure people don't sit in the ones that aren't appropriately spaced, or actually setting out chairs and tables so that they are appropriately spaced. Things like sinks. If there's 3 sinks in a row in the toilet area, then taping off the middle one so that people don't have the opportunity to stand next to each other, and things like that in the building, which you should all be quite familiar with now. And I threw this slide in because I thought it might be of interest to some people. The current Welsh Government guidance is that people are encouraged, if they're unable to work from home, so if they have to go into work on a daily basis, they're encouraged to do lateral flow testing. It's not a mandatory requirement, but I do know that some voluntary organisations, food banks, volunteers, etc., are using lateral flow as an additional safety kind of measure against COVID. Obviously, if you have COVID symptoms, then you have to go for what we call a PCR test, which you can get at one of the testing centres, and you have to isolate if you have symptoms. But these lateral flow tests are there for people who don't display symptoms, but just want to reassure themselves that they don't have COVID. But as I've said, it's not compulsory. If you do want to consider this for caretakers or managers or anybody that's regularly in the building, then they can be ordered online, or they can be collected from a local testing site. So thus we've covered the bit on the venue itself and the responsibilities of the management committee, and then we have the question of activities and what activities can we run. Now they are activities that fall within those criteria. They're activities that we associate with community centre activities, and no alcohol must be consumed. Other than that, it's not quite a case of anything goes, because there are some activities that are classed as high risk, and if anybody is looking to reinstate choirs or drama groups, then that's something I would encourage you to discuss with us in a little bit more detail. I need to get my head more deeply into that guidance and consult with environmental health colleagues. As I interpret it at the moment, these activities are permissible, but there's a whole other set of rules around them. So there will be things like additional distancing requirements, additional ventilation requirements. And so if you are thinking about singing or drama or performing arts of any kind, then it'd be good to have a conversation about that in a bit more detail, and we can ensure that you get the full guidance. Sport, recreation and leisure, we're all okay to run exercise classes, etc. indoors. Childcare settings should most of them will be running throughout the pandemic and should be fully briefed on their requirements, but there is a set of guidance there, and also for youth work services. And you also need to think about your terms and conditions with the user group. So many halls will be hiring their spaces to other users that come in on a weekly basis for a couple of hours to run an activity. And so you need to be very clear about what you expect them to do to keep the venue safe and to keep their participants safe. And then what will you also do? So who is responsible for cleaning and compliance? And I would suggest it is a mix of both. You may need to require that your user groups clean after they've finished, and wipe down the tables, etc., and wipe down anything that they would have regularly touched, but you may not require them to clean the toilets, for example. But being clear on who is responsible for cleaning, and ensuring that anyone who runs the activities fully understands the requirements of the regulations, both from the venue perspective, but also from the perspective of the kind of activity that they run, referencing some of the guidance that we've spoken about already. You need to share the risk assessment for the setting, but they also need to have completed a risk assessment for the activity, which they must share with you. And we've already talked about the permitted activities have their own specific guidance that they can refer to. And then a register of users needs to be kept. So this is a joint responsibility, and anyone running the activity would be expected to keep the register of users, but then they would be required to share that with you. So you have a list of anybody that's been in the building at a specific time, and that is obviously for the TTP process, which we talk about now. So those records are a requirement, so that if there is a case of COVID amongst somebody who has been in your building 2 days prior to being symptomatic or tested, then they will tell the contact tracing team that they've been in your building and that they've been at a specific activity. There may be not any required further action, but if the contact tracers feel that they have potentially put other people at risk within that activity, then they may contact you for information on who was in the building at that time. So you must retain that information compliant with GDPR for 21 days. Alongside this, you can encourage people to use the app, but that is not a replacement for this requirement. You also have to keep your own register of people. And environmental health are the team that run most of the contact tracing service. So they will be interested if they receive reports that measures haven't been complied with. They'll also be interested if they see a pattern of positive coronavirus infections that have come from a single activity. So if 3 people that went to an exercise class at a centre on Monday afternoon. If they all test positive within a couple of days of each other, then environmental health may start asking some questions, and at that point they may come and chat to you. Now, there's absolutely no reason to be concerned as long as you've taken reasonable measures to comply with the guidance, and they will guide you. If they think that you haven't done something in the right way, they will guide you to be able to put things right. They will only use their enforcement powers if they feel they have to. So they have the power to issue an improvement notice, which will give you a fixed time in which to improve the situation, or they may issue with a closure notice, which means that you have to close because your breach has been quite serious. But those scenarios are really unlikely. You know, the fact that you're on this call today, the fact that you are looking to take all reasonable measures means that you really shouldn't be concerned about a visit from environmental health. Okay, so that's all the venue kind of safety guidance. Is there any, are there any questions at this point?
Hi, Conjo from Griffithstown Community Hall.
Hiya.
Hi, I wonder how the collection of contact details and names fits with the GDPR law.
Yeah, so we can provide some further guidance on that. So the people who are visiting the venue, they are required to leave their information. There is a requirement in law for contact tracing and the infection control measures, the legislation under COVID. But at the same time, I think, and I say I think because I do need to double check this, they are, by signing that form, giving you the consent to hold that information for that purpose. So all the legal requirements are in place to be in compliant with GDPR. What you need to do then is store that information safely. So you would probably need to keep it in a locked cupboard or a locked box or something for 21 days. Does that answer the question? Is that okay?
Yeah, that's great. Thank you very much.
Okay. Any other questions? No? Okay, but if you feel free to continue to put questions in the chat or to contact us afterwards. I did have a list of questions sent to me earlier today. I think most of the content we covered during this conversation, but if you have submitted a question that you don't think we've answered, then please let us know. But we'll also go back to those questions specifically when we send out the presentation and give responses against each of them. Okay, so the next thing I wanted to touch upon is how we encourage people back. So from my perspective, really interested in community wellbeing, keeping people well within their communities. It's really important that we get people to reconnect. We've got lots of loneliness and isolation, mental health issues, anxieties, physical health issues, that some of which can be tackled by people just re-engaging with their communities. But we have to do it with them at their own pace, because we do have a thing called COVID anxiety, and people are nervous about re-engaging, particularly if they've been shielded, particularly if they've really not been out and about for the last year or so. So there's a couple of things you could look at, and I would really encourage you to look at. The first of which is the Get There Together campaign. So this was originally targeted at dementia sufferers, but it has applicability to anybody who's anxious about going back out and about. It's basically a set of photographs, images. Patrick, do you want to just click on the example? So it's a set of images, so you can take some photographs of the entrance to your building, what that looks like, whether there's any signage in place, when people enter your building, if there's any directional arrows on the floor, photographs of that, if there's any hand sanitizer equipment in place, and basically an image of their journey through the building. We can then use some Adobe software to install those images and make a short film, as T-Serial have done. And this then gets uploaded onto a website called Dewis, and you can you can share this through your social media channels. So I'm not very technical, but it feels like it's quite easy to do. And I do have the guidance and the links to the people that can help make these short films. So if you are interested, then please get in touch with me, because I think this would be a really good thing to share with people, to give them that confidence and to know what to expect when they enter a building. So that's the Get There Together campaign. The other thing that we're going to be doing over the next couple of weeks is launching a Let People Know That You're Open campaign. So I'm not a big fan of mapping exercises. Public services will often talk about mapping all the activities and stuff that's out there. But if there was ever a time that we need to map what's going on, it's now, because so much has stopped. Some of that won't restart. Some of it will have changed, and some of it will be brand new. So you'll see information on this campaign over the next few weeks through social media channels and emails, plus posters and things in venues. I may well come round and visit some of you. But what we want people to do is upload their information onto Dewis. If Thomas or Patrick maybe pop the Dewis link into the chat, or Info Engine, two alternative platforms that you can use to get your information on that people can access, and we'll be do lots of presentations, lots of publicity around those things. And then the last thing is, which I'm sure that you all do, is really respect people's boundaries. So I mean, I've got an elderly aunt who is absolutely chomping at the bit to get back to her craft group, and I'm sure that she will. But then there will be others who are just really nervous about that and need to do it in their own time. So me going along and talking to one of those people and saying, come on, let's go, is not necessarily the right thing. We just need to gently encourage people back into activity. And one of the things that we can do to maybe enhance people's confidence is raise the profile of the Distance Aware campaign. So you may have seen some of this branding. It's not as well known as perhaps the Bevan Commission would like it to be, but the shields, they come in various colours, but we have posters, we have badges, we have lanyards that can really sort of tell people that they're distance aware. So if you wanted to display those posters in your venue, if you wanted people to wear badges just to reinforce the point that they are distance aware and they are respecting people's distances, then get in touch, because we can provide you with those resources and materials. And that's me done. So are there any questions for me at this point before we hand over to TVA colleagues? No? Okay, well, thank you for your time. And remember that, you know, you can still continue to ask questions in the chat or contact me after the session. Over to you, TVA.
Okay, Thomas, it's you talking about funding.
Okay, so yeah, as you can see on the screen, it's not, that doesn't look like me, but it is me. I'm Thomas. I'm the funding officer at TVA. So I'm just going to speak to you a bit about some funds we have available and explain what other services that we can do to support you as a organisation. So at the moment, we've got two funds available within TVA. One of them is the SEF, which you may have heard of in the past. It's a Welsh Government fund called Volunteering Service Emergency Fund. We've changed the name to Engagement Grant now to allow organisations to engage with the community after these restrictions are in place. So if you were interested in that, there's a grant of up to 10,000. You can use it for important renovations, just equipment needed, for example, like signage or barriers for COVID. So if that's something you're interested in, get in touch. Another one is we've got ICF. So this grant is mainly fixed on one of the 5 criteria on the bottom. So all the people with learning disabilities, children with complex needs, early intervention, and carers. If you have a project happening within your community hall that yourself or an outsourcing organisation providing, send them our way. There is a link on the bottom of the PowerPoint which you can actually click on once you've had the slides. You can apply for up to £20,000 for a 9-month project. So as long as you fit within 9 months your project idea, you have a chance of gaining that money. But again, contact me for more details. One more thing on the funding, which I haven't put on the slides. In the next few weeks, we're holding a local giving session. So it's a good fundraising source. So it's like Just Giving, but just local giving instead. It'd be good for yourselves to attend, especially if you're looking at ways of making fundraising for your organisation for particular projects. So if you want to know more about that, visit our website. If you want to go to the next slide. So the next thing in there now is volunteering. I'm not going to go into too much detail on this because I'm sure there's a lot of stuff you are aware of already. I mean, one of the things we can do is help volunteers or individuals find an opportunity and place them in the most appropriate opportunity for them. We're working alongside Anira Bevan and TCBC to create a community of volunteers. So this is a group of well-prepared volunteers who want to provide much needed support to residents or community groups in Torfaen. So if you know of anyone who may benefit from that, send them our way. If you're looking for volunteers, this is something else we can support with. With our role as a volunteer service, we don't only recruit volunteers for organisations or help volunteers find an opportunity. We can work around making sure you've got stuff, that relevant policies and different things in place just to ensure that you're safe and covered for if you do recruit volunteers. We've got a volunteer management forum. So this is something that we're trying to do. We've got a session tomorrow. The aim is to let you as an organisation, if you have volunteers, meet with other third sector organisations in Torfaen, sharing how you manage or recruit volunteers. Is a great way of networking and sharing your ideas with others. And the last thing we do, which again we are working in partnership with both Anira Bevan and TCBC, is we're doing a recognising and celebrating volunteers in Torfaen. So we're sharing positive experiences and stories. If you know of anyone that you feel should benefit from this, send them our way, and we'd be more than happy to get in touch and promote what service they've done for us.
Thank you, Thomas. And of course, we have Volunteers Week in June as well, but we'll be sending out more information about that as the time gets closer. We're also looking to launch in the next couple of weeks a brand new platform. It's a community network for Torfaen for you to list your activities, your services for all the third sector, for any community groups, and also for individuals who want to connect up with those groups and activities. We'll be sending out more information about that as and when the time allows us. Meantime, though, that is it really. Here's a list of the contacts. You will be getting these on the slides when we send them out. There's Emma's contact details, there's contact details for TVA, and for any community halls in Torfaen itself, you can contact Perminda via the details there. But that is it, unless you have any questions. I shall stop sharing my screen.
Could I just go back and ask a question about Emma, please?
Yeah, sure.
It's Linda Westerman. I've come in as a guest. I was running late, bit rushed, all that sort of thing. I'm the secretary of Hentless Village Hall. We are opening on Monday, and most of our regular organised classes are coming back, and that's all being finalised at the moment. When we were last allowed to open, there was one particular, well, perhaps two particular activities that were a problem, and that was our bagpipers rehearsals, and we said they couldn't come in and play bagpipes because of all the air going around, and was similarly with people like dance classes or people wanting to have music and dancing. Similarly, we didn't allow that. I presume the same situation applies from now on about music playing and dancing. So A, can you confirm that's true? And B, should the situation change so that we can start to allow groups in playing music and dancing, or like dance rehearsal classes or music rehearsal, will you be keeping us on board with that as well?
Yeah, so thanks, Linda. Really helpful question. Dancing is permitted. I will absolutely double check that tomorrow, but I know that it was permitted previously. So dancing is classed as exercise, and that is okay. There may be some restrictions in relation to like couples dancing. So it depends on the type of dancing and whether couples are from the same household. But I will read the guidance properly tomorrow on that and come back to you directly. Bagpipes, I'm going to need to consult with environmental health colleagues. I would say no for now. But I know this gave myself and environmental health colleagues a bit of a headache the last time we reviewed it in relation to anything singing or wind instruments. So I want to be absolutely sure on the information I give you. So I will check with colleagues tomorrow on that, if that's okay.
Yeah.
I'm assuming Patrick or somebody has your contact details you can pass on to me.
Yeah,
Yeah.
thanks,
Yep.
Patrick. Yes, certainly the bagpipe issue was discussed at length and with Patrick and various people, and it was agreed that no to blowing bagpipes. But they went ahead and bought electric chanters, so that effectively it was the bagpipe rehearsals, but without any blowing of wind. But I'm sure that they would be more than interested to know as soon as they can come back, you know, properly with bagpipes, and that's just something I'm hoping you'll be able to keep us abreast of should the situation change.
Yeah, definitely. We'll keep people abreast. We'll make sure that that information comes out through networks, but specifically I will follow that up. I've got a couple of queries from the earlier session today to follow up on. So I'll do that in the next couple of days and get you a response as soon as I can.
Great, thank you very much. Thank you.
I see Leanne's got a hand up. Leanne.
Okay, coming through. Yeah. Yes, I'm Jan Smith, actually. I'm on Leanne's line with Thornhill Community Centre. We run a meal, a lunch on a Tuesday once a week. What will the situation be as for seating at a table? Would it be a certain number at a time, distance-wise, or will there be a limit on table settings?
So the restrictions, so you need to understand how many people you can have safely in Thornhill. I was at Thornhill Community Centre yesterday, actually, but I've been to the hall several times before. Your space, I would say, without pacing it out, is suitable for the 15 maximum. But then they would need to be seated 2 meters apart. So anybody that's not from the same household, you would need to arrange the tables in such a way that they're 2 meters apart, front and back and side to side. So it's probably a case of doubling up tables, isn't it? And having people sat either side of a doubled up table. Does that make sense?
Yes, yeah.
Together, one on
Yeah. What about temperature checks? Would we have to do temperature checks as well as they came in?
It's not a requirement. No, temperature checks are not a requirement. You can opt to do that should you wish to have that enhanced safety in place, but it's not a requirement. The people need to wear the masks as they're coming in, and once they're seated, because they're eating, they can remove those masks. But temperature checks is not a requirement.
Right. And the other is, there's always 4 to 5 volunteers. Do I understand that they can be allowed on top of the 15, or will they have to be included?
Yeah, so as long as you feel that's proportionate, so you can justify every one of those volunteers in the delivery of that service to those 15 people, then yes, they are on top of the 15. Also ensuring that that's within the maximum capacity of your room.
Yes. Yeah. Okay then. Thanks. That's a help. Yeah.
Emma, I just wanted to ask a question. It's Leanne, it is.
Hiya.
Sorry to interrupt then. It was about the groups in general. When it's set at 15 now for the numbers, over the next coming months, are the figures likely to change and more likely to go up or down? How are our users supposed to adjust with that? Would they have to do risk assessments and the larger groups and so on? How long will we get more information coming through?
Yeah, so we will work with TVA. So as soon as those guidance starts to change, then we will ensure that TVA has that information and can distribute it to you. The expectation is that we will move up through the alert levels. So we're out of alert level 4 into alert level 3. We will move into alert level 2 and then alert level 1. And as we move through those alert levels, the maximum numbers of people that can be in community centres will increase. So as soon as we know the dates for that, then we will make sure that's communicated to you. All you will be required to do is update your risk assessment to reflect the numbers of people in the room.
Okay,
so
thank you very much.
You won't need to reassess.
Right, I appreciate that. Thank you very much for answering our questions.
Okay, no problem.
Thank you.
So anybody else?
Yes, yeah. So if anybody thinks of anything after the session tonight, happy for you to contact me. And also, as long as I don't get inundated, I'm happy to come along to your centre and have a chat with you about the specifics if you feel that would be helpful.
Not sure if there's any more questions, if there is. Or can we finish early? I don't think there's any more questions, so thank you.
Oh, got a hand up. We have
Corinne.
Sorry, last minute. Yeah, the grant funding that Thomas was talking about, I wonder, would that cover the purchase of hand sanitizer, signage, sticky tape, and all of those sorts of things? Or what do we do? How do we go about? I mean, I know presumably they're for sale all over the place on eBay, Booker, or whatever, but is there funding available to help with the purchase of that? Because obviously it's money that the whole bank account will have to be spending that wouldn't have otherwise been having to do.
So yeah, with the engagement fund, that's something you can use it for. We're not limited to buying for projects or anything, especially if you're looking at opening your hall and you want to make sure that you're safe and you have everything that's needed for requirements. By all means, just do an application and send it our way. That's not a problem at all. Okay,
thanks for that. One other thing, which might help Linda at Handless, there's an organisation called T-Cerdd based in the Millennium Centre, which is all about promoting Welsh music. And if you can Google them, TYCERDD, they recently put out some useful information about choirs and wind instruments and whatnot. So that might be helpful, might not.
Thanks, Corinne. Pick that up. Yeah, okay.